Nearly 800,000 total knee replacements are performed each year in the U.S. If you think you're headed that way, there may be a simple solution to keep you out of the operating room. Researchers say building up your thigh muscles may be the secret. Your quadriceps and hamstrings work together to help you walk, run, and jump. When moving your leg, the quadriceps contract and the hamstrings relax, protecting your knee joint. But an imbalance can change those biomechanics and lead to the progression of osteoarthritis, according to the researchers. In a new study, they compared thigh muscle volume in 67 patients who underwent total knee replacement and 67 control participants. The results showed having stronger thigh muscle significantly lowered the odds of total knee replacement, but so did overall muscle strength and balance between these two important groups. The authors say although the study focused on people with arthritis, the findings may also help others who are physically active. The lead author says, while these results are essential for targeted therapy in a population at risk for osteoarthritis, even the general public can benefit from our results to preventatively incorporate appropriate strengthening exercises.